Okay, why don't you tell us a little bit about yourself?
My name is Kurt Knauth. I'm a physician here in Austin, Texas. I grew up in Beaumont, Texas, Southeast Texas. Went to Texas A&M University, then University of Texas in Houston for med school, and then I moved up to North Carolina. I went to Duke, where I did an internship in medicine, and then a residency in anesthesiology, and then stayed on another year to do a fellowship in cardiothoracic anesthesiology. So it puts me up to 2002 when I moved back here to Austin and been here ever since.
Could you describe what a typical workday looks like for you?
Yeah, it varies fairly widely. Typically, I'll wake up at 4:35 in the morning, usually at work by 6. There's a lot of preparation work to be done for anesthesiology for the patients. You have to get all the rooms and equipment ready. You have to see the patients, evaluate them, do a history, evaluate the risk, talk to them about what the plan is after you formulate the plan. And so for a surgery that might start at 7 or 7:30, you typically have to be there a little bit earlier. We vary in my group between doing your own cases where you provide anesthesia personally for one patient, and then sometimes we supervise nurse anesthetists where we'll have one doctor and 3 or 4 CRNAs where you'll supervise what they're doing. And so in our practice, we're kind of mixed. Many days you do what we call supervision, many days you do your own cases. So the variety is nice. It provides a good change of pace for things.
What's your favorite thing about what you do?
Favorite thing is interacting with people. You have to interact with a lot of people. So particularly the patients, those are the most fun to interact with. I enjoy, you have kind of a short time window to get to know people because you're just meeting them right before their surgery, and to them it's a very stressful experience. And so not only learning about their health, but also learning a little bit about them. If you can get them to laugh a little bit and relax a little bit, I think they find that very helpful. On the backside, we also round on our patients in the hospital for acute pain issues, and we usually follow them after surgery. And so I get a big kick out of talking to the patients afterwards as well, getting to spend a little more time talking with them. And generally, I think they appreciate that. I think they like people who are real and just want to talk to them.
What would you say is the most rewarding and the most challenging on the flip side aspects of your job?
Um, Rewarding, lots of rewarding parts. That's a tough one. I think when you feel really good inside, it happens a couple of times. One is when you do something selfless. So whether that's in mission work or whether that's you're helping with somebody with a problem that may not even be in your field, that they just need your help, or that patient just needs your help. That's very, very rewarding. Also, when you do things that are very difficult. So I do cardiac anesthesia a lot. We do heart transplants and ventricular assist devices, and I do echocardiography where we look with ultrasound at the heart, and there's a lot. That level of anesthesiology is very precise, and as opposed to, I don't want to say having your gallbladder out or getting your appendix out is not precise, but the margin for error is much less. And so if you can get somebody who's critically ill through a case and have them do well against the odds, I think that's very, very, very rewarding.
And the most challenging part?
Most challenging. You interact with a lot of people, as I alluded to before, which is something I enjoy, but you also interact with a lot of people. And so sometimes that's not always good. There's a lot of time pressure. All the hospitals, facilities, they want to start exactly on time, and the turnover times, which is all good, and we encourage that. We want that too. But there's a lot of sort of what I would call production pressure to get things done, to get cases done, to get people. There's a lot of people to be taken care of. So there's kind of the system part of it, and there's the patient part of it. And the system part of it isn't quite as fun.
Makes sense. You mentioned mission work when you were talking earlier. Have you ever been a part of that?
I've done some, not as much as I would like. You know, we talked. You know, when Haiti had their earthquake, I went to Haiti with Mission Hope, and we camped in tents. We were talking about camping earlier, and all the city, Port-au-Prince, and all those citizens had moved. The bulk of them had moved out of the cities and into the hillsides, and so they're just tarp villages up in the hills. But there was no way to get them good medical care. So we were there probably 5 weeks after the earthquake, my team. And so you were seeing a lot of injuries that had healed, but healed incorrectly. So they might have broken their arm and it'd be displaced, and there was nothing anybody could do. And so they come to you and it's partially healed, and it's in a odd configuration. And so we did a lot of orthopedic surgery, a lot of plastic surgery. We stayed on the grounds of a small orphanage, so we played with the orphans a lot, and that was really cool. I wish my kids could have been there with me for that. But it just gives you a totally different perspective when you come back. You know, when you're doing surgery on somebody, let's say you fix their arm and you write on their cast, you know, cast should be removed in marker and 3 weeks. Take this antibiotic, we'll try 3 times a day, and see you later. Good luck. You know, and these people are just going back out to wherever it is they're staying. So just crazy level of poverty there, and then you couple the disaster, and it just was a perfect storm. So when you go and do that, you come back and you're just like, wow, you know, we have it really good in this country. Even, you know, but going back to more mission work, I went to New Orleans after Katrina, and same sort of thing, just desolation, and you see all has been taken from people. And I think, one, it feels great to give, but two, you carry that perspective with you forever as far as what's really important, what we really value, what we take for granted. So I think, you know, it's funny you mentioned that to me, because I'm like, I'm due for more mission work. Sometimes we do non-medical stuff too. So I took the boys and some scouts down to Houston after the hurricane, and we just went down and took the RV and ton of water, ton of fuel, and set up camp down there. And we just went from house to house, tearing out drywall and trying to get all the insulation out. You know, these homes that have been flooded out, and that was pretty dirty work. But it doesn't have to be medical. You know, I mean, there's people, lots of places. So, you know, I would encourage folks to, you know, as you're developing your career and whatnot, if you get the opportunity, and I tell my boys this about their friends, like if you get the opportunity to help your friends, if they really need your help, always take that opportunity, because that real opportunity doesn't come up very often. So you don't get to prove to people very often exactly how you feel about them. And the same thing is true for mission work. If something happens and you know, there's a catastrophe here in the United States or somewhere close by, and through your church or through your school, there's like this opportunity, and you're thinking, man, you know, I think I'd like to do that. I should do that. Just jump on it and go and do it, and you'll be really glad you did.
One of my dreams, I guess, is to do medical mission work, and I know all of us are looking to enter the healthcare field and probably want to do that at some point of our lives. Is there a specific amount of time that has to pass as you practice before you're able to go do that, or can it happen? Like, what does the timeline look like?
No, there's not. It depends on your job, you know, obviously, and that if you can have the time with your work, or if your work is going to accommodate that sort of thing. So, but no, they love to have people. So, I mean, it depends on what you do. You could go now, and, you know, you're not going to perform surgery on anybody, but there's plenty of other jobs to be done. So I'd encourage a little dabbling in that in college, and you just go, and your job may be, you know, reading books to children. But if you're doing it in Nicaragua, you know, that's pretty cool. Or Africa, or go build a house, help build a house, or build a church. There's lots of non-medical mission work to be done for sure. But for the medicine part, no, you can go. I mean, there's residents that go. There's medical students that go. There's any time in your career. So I'd encourage you to take the opportunity whenever your time allows. Many times it's a time problem.
Do you think you'll do that again in the future?
Yeah, most definitely. I was thinking about that just this morning when I was walking to lunch, because we were talking about some other things for business, and it's like, it's been a long time since I've done. I mean, Houston was not long ago, but like going out of the country, and we have multiple physicians who do Austin Smiles, which is a group that goes down to Central America and does plastic surgery, cleft lip surgery, and things like that. And we have other groups that go to Africa, but you just got to make the time and take advantage of it. So it's something I definitely am interested in doing sometime in the next year, hopefully.
How did you decide on anesthesiology?
Well, I didn't know anything about anesthesiology at all. So I went through college and 3 years through medical school, never met an anesthesiologist, no idea what they did for a living. At the end of my third year, I was thinking I was going to do surgery or OB. And so I had all these surgery rotations. Your fourth year was all electives. So I had a bunch of surgery rotations, a bunch of OB rotations lined up in the fall of my fourth year. And my first rotation was at Herman in Houston. And it was excuse me, dog. Can I do that? It was the neuro ICU at Herman, but it turned out it was run by a couple of anesthesiologists. So they had done anesthesiology, but then rather than like cardiac fellowship, or we have pediatric fellowships or pain fellowships, they did an ICU fellowship. So they didn't do regular operating room anesthesia. They did. Excuse me. Sorry. They did purely critical care. And so these two guys were just studs, and they were super smart, very well read, kind of took me under their wing, and they would, these critically ill neuro patients who are intubated, typically trach. They're usually on rotoprone beds, which are these beds that roll, the whole bed rolls over so they don't get pressure sores. They're critically ill. They have, intracranial injuries, and so you kind of have to go system by system down and manage each thing, neuro, pulmonary, cardiac, GI, so on and so forth, each day. But they really forced me to make decisions, like, this is what we have, do this and this, what are we going to do today, what are we going to do about that. Great month. And then I was like, man, these anesthesiologists are pretty cool dudes. And then I'm kind of looking around, I'm like, who do I want to be when I'm 50 years old? Do I want to be those guys who are smiling and seem to really enjoy their life and taking care of their patients? And do I want to be that guy that looks really angry over there, that general surgeon over there that's just really mad? And so at that point, I decided to look around a little bit more. So I changed all my fourth-year rotations just like on the spot. So I just literally picked up the phone and started calling programs up and down the East Coast. So I stayed at UT and did, after that ICU rotation, I did an anesthesiology rotation to see if I would like it, like a traditional OR operating room anesthesiology. Enjoyed that. Then I drove over to Emory in Atlanta, and I did another ICU rotation, which was run by anesthesiologists. That was a cardiac ICU at Emory for a month. Rented a room from some lady. Great month. Then I drove up to Duke, did an anesthesiology rotation, 1 month rotation there, and then really enjoyed that. Loved Duke. They really sort of specialized in regional anesthesia, which is where you inject local around just particular nerves and numb particular parts of the body, and then they did a ton of cardiac, which were two things that really interested me. And so then I came home, finished med school, and ended up matching at Duke.
Very cool. And how would you say that your undergraduate education helped you in that process and where you are now?
One, it helps everybody and is social. So there's the academic part of it, but there's also the social part of it. And you make friends that you're going to have for the rest of your life, and you'll keep coming around and touching base with people, and that do that. Two, I think high school, but also college in a much bigger way, and in med school or other professional school after that, um, it gets harder and harder. And so developing good study habits, not getting behind, figuring out when you get behind and catching back up quickly. Because as you go further in school, it gets harder and harder to catch up. And so having good study habits, having effective, efficient study habits where you're not just studying, but you're actually making progress in what you're doing are very, very important skills. Certainly, the background is good too. I think of all the classes, you take as prereqs, chemistry, organic chemistry, not so useful. It's good to know those things, but I mean, if you're not going to be doing pharmacology all the time, in a scientific way, I do pharmacology, but it's more in a practical way. It's not that helpful. But I love biology, I love cell biology, and I love anatomy and physiology. Were the classes that I thought were most appealing, and physiology greatest of all. Just cool stuff that I use every day.
Awesome. What would you recommend to undergraduate students that are looking to pursue healthcare professions?
Look around, get out, introduce yourself, intern where you can, get a job where you can, even if it's a menial job. Let people get to know you. So, like as an example, you go back to my going to Duke and doing a rotation. Well, for that month I was there, they learned who I was. So I wasn't an unknown entity to them. So they get my CV and they see my test scores and everything else, and that's one part of it. But they also want to know what kind of person you are, and that's true of any job, and that's true of if you want to go to a professional school. You probably ought to go, try and work in one of their labs or try to get to know some of the people. While you're there, put yourself out there and get out and move around in a bigger setting. Don't just stay in your lab. Get out and introduce the people and tell them you're interested in things. If you're interested in nursing, get out and see what nurses do. There's lots of different jobs, right? Lots of different nursing jobs, lots of different anesthesiology jobs. So it's not just one thing. You can, in many of these fields, you can probably find something that interests you. In anesthesiology, for example, people just think of propofol and field. I mean, we have people that just do kids. We have people that just do hearts. We have people that just do pain. We have people that just do ICU, and the same is true of nursing. We have people that do ICU, floor nursing, OB nursing, ER nursing. All sorts of life flight nursing, all sorts of cool things to do in any of those fields. Also, if you have an interest, don't be afraid to look around and ask questions. Like I see people that, like a fairly common one I see is people want to do pediatrics because they love kids. Great. They also want to do mission work. Wonderful. A run-of-the-mill pediatrician generally not going to make a ton of money, which is fine. It's not a problem at all. But there are lots of pediatric subspecialties that you can do in a variety of fields. You can be, pediatric anesthesiologist, pediatric surgeon, pediatric infectious disease, pediatric cardiologist. There's all these other subspecialties that no one ever thinks about, right? And in this case, you get to work with kids. You might make a little bit more money because if you want to do mission work, you do have to fund a mission. You have to be able to. You have to be in a position where you can afford to take the time, and you have to be in a position where you can afford to the expense of what it takes many times to go do a mission trip.
Do you have any other advice in general?
I think we've covered most of it. I think, the pool of applicants and the pool of people you're going to be competing with and whatever it is you want to go do is large. And so finding ways to set yourself apart, The obvious way is awesome grades, great test scores. That's the obvious thing. That's what everybody's thinking. That's what everybody's doing. So yes, you need to do that, but seek the extra. Seek out a personal connection, whether that's through a job you do, whether that's through volunteer time you do, whether that's through family, friends, whatever it is that you can get some sort of connection to get something in. If you decide to go, let's say you're interested in being a medical professional of some type, and you're going to go. You're going to go to a hospital and volunteer your time, for example. Make use of that time too. Use that, volunteer your time, do your job, what you're supposed to be doing, do a great job at it. But also put yourself out there, try to figure out, is there something else I want to see while I'm here? Is there somebody else I want to meet while I'm here? People love it when you're interested in their job. And so if you seek folks out of something you might be interested in, you think you may want to deliver babies, seek an obstetrician out. Well, man, I don't know much about it, but I sure would love to follow you around for a day. I'm a student at UT, and I'm doing this, and they would jump all over that. And same thing for surgery, same thing for medicine, pediatrics, cardiology, any of those things. So not only do those volunteer times, I mean, those are little items you put on your CV, but everybody's doing that, right? And so you need to do that and put yourself out there, introduce yourself, let people know who you are.
Alrighty, well, I think that's about it. Thank you so much for your time.
Well, thank you guys so much. I appreciate it.